Hi, everyone. Welcome to our USMLE Prep Q&A live session. Today, we're joined by the wonderful Aksa Chaudhry. How are you doing today?
I'm doing great. How are you?
I'm good. We have our little space heater in the office because it's a little chilly over here. But yeah, we're doing great. So thank you for everybody who had messaged us in on social media about our question we posed last week. Now we're going to kind of go in that question, take a deep dive in it, kind of find out what were the key takeaways and the answer, and then kind of dive into that a little bit. So without further ado, let's hop into that PowerPoint. Beautiful.
So if you guys are not a current St. James student, I highly recommend that you join us because it's been a great experience, working in the office, really getting to know what St. James is all about. They really want to provide you an education that is affordable, but also very much doable. And a lot of our students do end up getting residencies in the U.S. and Canada. So if medicine is something that you're really interested in, I highly recommend it. Okay, so Megan kind of already introduced me, but my name is Dr. Aksa Chaudhry. I work along with my wonderful co-counselors, Dr. Russell Heckburn and Dr. Dwan Kinchlow. All of our email addresses are there. If you ever want to contact us, if you have questions about USMLE or NBMEs or the school in general, feel free to reach out. Or you can reach out to the general email there, usmle@mail.sjsm.org, if you don't want to send a personal message to one of us, but we do have access to that email address as well. You can apply on the school's website, sjsm.org.
Yes.
Right, so the question for this week, we have a 34-year-old woman who comes to the clinic with complaint of right wrist pain radiating to her right thumb. She denies fever, swelling, or redness near the affected area. She has difficulty grasping items with her right hand. The patient has no significant past medical history or surgical history. She denies alcohol and tobacco use. She gave birth 6 weeks ago to a healthy boy via normal spontaneous vaginal delivery. Vital signs are within normal range. Physical exam reveals pain on ulnar deviation of the thumb when it is adducted in a closed fist. So what is the most probable diagnosis in this patient? Is it A, rheumatoid arthritis, B, decorvating tenosynovitis, C, carpal tunnel syndrome, or D, osteoarthritis, or E, ganglion cyst? So as someone who spends most of their day in front of the computer, I can definitely relate to this vignette, constantly have wrist pain. But as I'm going through this vignette, there are certain key factors that I'm looking at. So 34-year-old woman, she's likely to possibly have an autoimmune disease. Autoimmune diseases are common among women of reproductive age. And she did just have a baby, so that's high on the differential. So, and then she has pain radiating to her right thumb. If I'm thinking about differential diagnoses, a top one would be carpal tunnel syndrome, but you might not necessarily have pain in the right thumb with that. So this could be something else. She also has difficulty grasping items. So maybe it's a radial nerve impingement. And there's, on physical exam maneuver, she has pain on ulnar deviation when her thumb is adducted into a closed fist. This is a very specific maneuver that provides clinical diagnosis. And which diagnosis it is what we're going to be trying to ascertain in this patient. So the different options, rheumatoid arthritis is a chronic inflammatory disease. Decorvating tenosynovitis is injury due to repetitive movement. Your carpal tunnel syndrome is due to entrapment of the median nerve. Osteoarthritis is a degenerative joint disease, and ganglion cyst is a benign lump that can develop along the tendons or joints of the wrists or hands. So what do you guys think is the correct answer in this case? So we've got some answers coming in, so keep popping in the answers.
Yeah, we'll give you guys a couple more seconds to kind of go over your answer choices in your head. Type it down in the chat bar below. Just going back onto social media, we had a lot of people typing in, responding that it was B. So soon we'll find out if that answer is correct and like what the other options are, kind of discussing what they mean and why they may not be the right one for this specific question.
Yeah, wrist pain is quite a common injury that a lot of people go through, like whether you're at a keyboard all day typing away, doing your research thesis, or just working, trying to communicate, emails all day. But also the way we hold our phones, and we don't have the best sleep posture. So a lot of factors leading to wrist pain, back pain, other sorts of chronic conditions.
It's very interesting. Okay. So if we're not going to have any more answers, we're going to go ahead and kind of talk about the answer selection.
But before we get to the answer,
the nitty
I
gritty,
wanted to talk about the maneuver that was mentioned. Anytime that I come across something that I may not be familiar with, whether it's like a procedure or a specific maneuver, I always make a point to look it up so that I have a point of reference. So it might be hard to picture in your mind what the thumb in the wrist adduction necessarily means in words, but here in the picture that you can see what that exactly entails.
Okay.
So you would have the patient put their thumb inside their wrist, close their fingers on it, and then the doctor will go ahead and deviate it. And if that causes pain, then you have decorvane tenosynovitis. So let's talk a little bit about what that is. So this patient developed decorvane tenosynovitis due to repetitive activity of holding her newborn's head with an extension of her thumb and index finger. The tendons involved include the abductor pollicis longus and the extensor pollicis brevis of the thumb. Clinical presentation includes pain on the dorsal part of the wrist and thumb, possibly radiating proximally or distally. The Finkelstein test, which was shown in the previous image, is positive with pain on ulnar deviation of the thumb adducted into a closed fist, indicating decorvane tenosynovitis as a most likely diagnosis given the accompanying clinical presentation for this patient. So again, I like diagrams and pictures. It helps me to remember things better than just reading words. And these are the tendons, the muscles of the wrist, and it shows what is inflamed in decorvane tenosynovitis. So anytime you see itis as an ending, it's going to be an inflammation of whichever organ or organ system that you're looking at. So some causes and risk factors of decorvane tenosynovitis include repetitive movements of the hands and wrists, such as typing or grasping tools and objects. This may be also in mechanics who are working with their hands throughout the day, like using different types of tools, pregnancy, age over 40, certain metabolic conditions like diabetes mellitus, also inflammatory systemic disorders. So this could be associated with rheumatoid arthritis, psoriatic arthritis, or even gout. Also possibly infections of the tendon sheath. That would be your infectious tenosynovitis, and this can be due to penetrating injuries like animal bites or contaminated wounds possibly.
Oh, okay.
So the diagnosis here is mostly clinical, done through physical examinations. Patients will present with pain, swelling, and limited range of movement with the wrist. They'll have difficulty grasping objects, and there'll be worsening of pain with certain movements. And the way that we can diagnose is through specific maneuvers like the Finkelsteins. So you would grasp the thumb and ulnar deviate the hand sharply, and if sharp pain occurs along the distal radius, then decorvane tenosynovitis is most likely. So if we're looking to make some differential diagnoses, we might think of carpal tunnel, metacarpal tunnel joint osteoarthritis, where you have osteoarthritic changes at the base of the thumb on radiography, but the symptoms would develop over months to years rather than within the couple of weeks that this patient presented. There could possibly be carpal bone fracture, but you would again see fracture line of radial carpal bones on radiography. But this would be presenting acutely following trauma, and there was no mention of trauma with this patient, so that's less likely. So treatment, when you're treating decorvane tenosynovitis, it can permanently limit the range of motion or even cause tendon sheath to burst. So you want to immobilize the joint, you want to tell the patient that they should rest. Even NSAIDs, naproxen ibuprofen for pain relief. If you still have symptoms after NSAIDs, and you may need some corticosteroid injections. Surgery will be your last resort, but if patients' symptoms persist after several months of medical treatment, that could be a possibility. Now, a little bit about the other options. Rheumatoid arthritis is a chronic inflammatory condition, again, most commonly in women of reproductive age, 30 to 50. Clinical presentation will consist of symmetric polyarticular joint pain and swelling, specifically in the hands, elbows, knees, or ankles. Laboratory analysis may reveal rheumatoid factor, anti-citrullinated autoantibodies, and increased C-reactive protein, or ESR. And arthrocentesis of the joint will reveal increased neutrophils. We didn't have any of that with this patient. Another answer option that I've seen a couple of students pick was carpal tunnel syndrome, but that would present with tingling and pain of the lateral 3.5 digits of the hand and of the thenar eminence due to median nerve impingement. But that can be diagnosed with electromyography and nerve conduction studies. There's also specific maneuvers that can be done, such as the Tinel signs, where you would tap on the wrist and there would be some numbness or paresthesias there, or with Phelan sign, where you ask the patient to push their hands together and to hold it, and that would also lead to paresthesias, numbness, maybe some tingling as well, due to the median nerve impingement. So a little bit about electromyography. That's where they would attach electrodes to the skin, and then you would manipulate the muscle, and then the contraction velocity and amplitude is measured on a screen. If you did have some nerve injury, then there would be a latency, and the amplitude might be decreased as well with electromyography. Again, anytime that you're unfamiliar with a diagnostic procedure or what it entails, I always say look it up just so that you're familiar with it. And if you do come across it in questions, or if you're doing clinical rotations and you have a patient that does have nerve injuries, the preceptor may expect you to know what electromyography entails, and then you can be confident in your answer choices. The other options, osteoarthritis, is a degeneration of weight-bearing joints that commonly presents at the age of over 40 in women. Some of the risk factors include obesity, overuse of joints, possibly hyperparathyroidism, hemochromatosis, or inflammation of the joint. Patients present with stiffness and pain of the affected joint, and it usually worsens with use and improves with rest. The most commonly affected joints include the distal interphalangeal and proximal interphalangeal joints of the fingers, the metacarpal joint of the thumb, the hip, the knees, and the metatarsomphalangeal joint of the big toe. This disease would not have increased inflammatory markers such as ESR and CRP on laboratory analysis, however. And a ganglion cyst may occur between the ages of 20 to 50 years of age and presents as a benign mucin-filled soft tissue tumor, most commonly seen on the dorsum of the wrist. Patients will be asymptomatic or might have some mild tenderness. There'll be an expansion of the sides of the cyst and limitation in use of that hand, which leads patients to seek consultation of a physician. A ganglion cyst would have been found on physical examination of the patient, but there was nothing for this patient other than the numbness. So that makes ganglion cyst less likely. Okay. Well, thank you so much for joining us. And if you guys have any questions, please do drop them in the chat.
Yeah. Also, if you would like to reach out to any of our wonderful USMLE counselors, please, again, if you want to go back, rewatch this video, in the beginning, we had all of their emails and a great way to contact them. So shoot them an email if you have any questions, if you would want to go in depth on a couple of things, if we didn't address your questions in the comment section. But great. Thank you so much for joining us today. We hope to see you next Thursday on social media. And then that following Thursday, we're going to be back here live with Dr. Dwan? I think yes.
Dr. Kinchlow.
I think it's Dr. Kinchlow. So thank you so much for joining us. Have a wonderful rest of your day and the upcoming weekend. Bye, everyone.
Take care.